Long haul COVID could be the next public health crisis. That's according to a new article published in the New England Journal of Medicine. But what is long haul COVID and how will it affect the nation moving forward? News 8's medical reporter Dr. Mary Gillis is here with us now with a little bit more. Hi, Mary.
Hi, Alexis. Thanks. Long haul COVID is where someone experiences COVID-19 symptoms weeks or months after infection and recovery. Those people are referred to as long haulers. Most common symptoms include chronic fatigue, confusion, inflammation, among others. Data suggests between 10 and 30% of those infected with the virus will get this syndrome, which can last for weeks, months, and for some people, they are still sick a year later. But not only do long haulers suffer physically, mentally, and emotionally, scientists predict there may be economic implications and our current healthcare system could be upended. I spoke with Dr. Amy Beth Kretzel, infectious disease specialist at Eskenazi Health, to explain.
Not necessarily needing hospitalization, but maybe causing disability, maybe causing a long-term issue where people can't work or can't work the way they used to. We truly don't know, but we're talking about a significant added burden to the healthcare system and potentially a labor shortage.
According to the paper, the average age of patients with long COVID is 40 years old. These individuals are in their prime working years. Kretzel says this is a potential problem for the economy. So in the end, there may be numerous ramifications that expand beyond a patient's lingering physical symptoms. The best way to avoid long-haul COVID is to avoid getting COVID-19 in the first place, Kretzel adds. And the vaccines, she says, are likely to prevent long-haul COVID should a person get infected with the virus.
You know, Mary, that's really interesting how Dr. Kretzel puts it. But does she talk about anything else other than a person's decreased quality of life? Are there other ramifications there?
Well, in terms of the healthcare system, we talked about it sort of being upended in a way. And again, we still don't know what's going to happen, but we talked about possibly having hospital wings dedicated to long-haul COVID patients.
Okay.
But we just don't know yet. So.
Wow. It's an interesting thing to think about.
Well, yeah, Alexis, we'll have to see, right?
Mary, thank you so much.
Thank you.